So this is a good question. Can you use a GLP-1 agonist with biologics if you already have, let's say, an autoimmune condition like rheumatoid arthritis? Simple answer is yes, and here's why. So when you have an autoimmune condition like rheumatoid arthritis, psoriatic arthritis, or one of the other ones that are out there, frequently medications that are utilized are immunosuppressant medications. These are medications that basically are meant to hold back your immune system so that instead of being overly active and attacking yourself, they're now calmed down so that you're no longer getting that active inflammation. Some people, that control of the immune system is enough to control their overall inflammation and disease. In some people, it's not. The GLP-1 agonist medications like semaglutide and tirzepatide are a brand new class of treatments that basically work by mimicking an intrinsic molecule or chemical that your body has that helps to control your overall metabolic health. There is a connection between your metabolic health and your inflammatory health. So when we say metabolic health, we're talking about things like blood sugar management, and if that is out of control, eventually leads to problems like fatty liver, cardiovascular disease, strokes, heart attacks, all those kind of things. Our understanding for inflammatory conditions like rheumatoid arthritis, psoriatic arthritis, is that chronic inflammation puts people at higher risk for metabolic problems. We're starting to also understand that chronic metabolic problems can also put people at risk for higher inflammation long-term as well. So because of the link between autoimmune issues and cardiovascular disease, I like the idea of my patients with chronic autoimmune conditions, if they need that additional supplementation from a metabolic health standpoint, that they consider semaglutide or tirzepatide. But I also like that knowing that controlling your metabolic health does seem to help out with inflammation as well. I like the idea of actually including the GLP-1 agonists for our chronic autoimmune patients as well when needed. So for example, let's say you have rheumatoid arthritis and you also have sort of a climbing, kind of slowly rising hemoglobin A1C, indicative that you're slowly becoming diabetic, or you have a family history of heart disease. The GLP-1 agonists have the potential to help out with your overall metabolic health and prevent conditions like cardiovascular problems, and at least slow that down. But I also like the idea that if you have rheumatoid arthritis, and let's say you are on medication, and overall things are fairly well controlled, but if you still have a little bit of residual inflammation, utilizing a GLP-1 agonist to help not only your metabolic health, but also your inflammatory health as well in this case. Yes, absolutely, you can utilize GLP-1 agonists like semaglutide and tirzepatide if you're on a biologic treatment as well. And I think there is some benefit from not only a metabolic health standpoint, but also an inflammatory health standpoint.